Welcome to this presentation on Safewards. The aim of Safewards up front is to improve the language used by staff and therefore help them to work more collaboratively with their patients. As a background to this presentation, let's think about some of the challenges that nurses face in their everyday work on acute inpatient wards. When a person is acutely ill, they can be very difficult to help. It is the nursing task to make sure that deluded, hallucinating, overacted, agitated, and sometimes extremely distressed people get sufficient sleep, get up in the morning, wash and attend to personal grooming, wear appropriate clothing, eat and drink sufficiently. In addition, nurses build relationships with patients, foster social contact between patients, and engage in organised and social activities with patients. At the same time, nurses have to ensure that patients take their prescribed medication, don't leave the ward without permission, see various visiting professionals, avert or diffuse arguments between patients, and prevent patients from harming themselves. Often these activities are in the context of patients being formally detained in hospital under the Mental Health Act, or not understanding that they are ill and maybe not wanting to be on the ward at all. It is perhaps no surprise that nurses sometimes put patients off with delay tactics like "see you in a minute," "give me 5," or "come back later." This may be no surprise, but it is intensely frustrating for patients, as indeed it would be intensely frustrating for anyone. From all this, it's probably also not surprising that a primary flashpoint leading to violent incidents is limit setting. Whenever nurses have to respond to patient requests, ask patients to do something, or stop them from doing something, the temperature can rise on a ward, and there's a risk of frustration and wounded feelings on both sides. Patients can feel humiliated, disrespected, and treated like children. Occasionally, this escalates to conflict behaviours such as verbal abuse or even physical violence. Safewards provides some way to avoid such confrontations and work more collaboratively with patients. It's probably important at this stage just to give you a little bit of evidence about why limit setting and communication is so important. A review of incidents of physical restraint found that the most common explanation offered by patients for violence was conflict with staff. Issues involved in such conflict included enforcement of rules, denial of privileges, denial of requests, and denial of discharge. Another study found that nurses' limit-setting styles was more predictive of possible conflict than actual patient diagnosis. And finally, a separate study found that people with a diagnosis of antisocial personality disorder were significantly more likely to self-harm after being denied a request. So, what is the Safewards intervention? The Safeward intervention proper is essentially a simple one. A series of prompts with regard to communication will be set around the ward or given to individual staff. Particular to this, a poster displaying example of Safewards will be placed in the staff office. Safewards postcards will also be given individually to staff. These posters and postcards will cover 4 themes. To start with, we have respectful and polite. This theme focuses on being respectful and polite towards patients both verbally and non-verbally. It's about nurses showing genuine and empathetic respect. The principle really is treat others as you would like to be treated. One of the examples around this theme is the following. Let your whole manner express genuine respect, empathy and warmth for the patient as an equal. Verbally show your understanding of how frustrating or difficult this might be for the patient. Imbue that empathy for their viewpoint with warmth and genuine positive feeling for them. The next theme is turning down a request. This theme looks at how staff turn down requests from patients. It reminds staff to reflect on patients' requests, the reasons behind it, and it focuses on justifying the nurse's response and how this is conveyed to the patient. I'm going to give two examples from this theme. The first example is the following. First reflex should be saying yes, not no. Do you really need to say no? Can you justify saying no? Is this something that with a little bit of effort or work or checking you could say yes, or at least a partial yes to? And the second example, explain in detail and with good reasons why you cannot give patients exactly what they want. Our next theme is asking a patient to do something. This theme explores how staff request patients to do something, the way in which the request is made, how appropriate the request is for the patient, and how flexible staff are in their approach. Example. Be flexible. Talk through the task. Explore the patient's point of view so that they can feel heard and valued, and so that the timing or precise content of the task can be adjusted to suit their wishes. Understand the blocking factors and find workarounds and compromises. And finally, theme 4, asking a patient to stop doing something. This theme gets nurses to be clear on why the patient should stop and prompts the nurse to be flexible. Example. Ask the patient to stop. Do not order. This is much more likely to elicit cooperation and avoids a power struggle. Do everything to avoid insistence or a show of force. I wanted to finish these examples by letting you see a postcard that will be given to individual members of staff. This postcard is entitled Asking Someone to Stop, and it's in the form of a poem. And although it won't win any poetry awards, it certainly does get the message across. Sometimes it's better not to see, postpone or distract into activity. Never order, always ask. Explain and give reasons to accomplish your task. Seek understanding, find out why, quietly, privately. No act tough guy. Make some alternatives, express flexibility. Tell how to complain, it's your civility. We may be wrong, so please say so. Offer the patient a good quid pro quo. If all else fails, try another nurse, for fear of starting something worse. Wait for compliance. You don't have to see. The last word is theirs, automatically. I'd like to end this presentation with just a few words about the successful implementation of soft words during the Safewards trial. During the trial, wards that were successful found that it's important to display the posters in a prominent area, such as beside the office door. Don't hide them in the staff room or the toilet. They are no use to anybody in there. It was found that nurses liked the posters and the postcards, and they particularly liked the rotation of messages, so they had something fresh and vibrant to consider at regular intervals, hopefully daily. But the last thing we would like to say is that a dedicated and motivated ward champion was crucial to the success of the intervention. The ward champions who were crucial often were able to model the skills that were displayed in the messages on the posters and postcards. But they worked very hard at ensuring that the posters were rotated, and so that nurses could be challenged, prompted and refreshed on regular intervals. We would like to dedicate this presentation to those ward champions. Thank you for listening, and take care.